Welcome!
We learned about billing and coding, a toenail debridement procedure. Today, we will talk about billing and coding for foot care services that are not covered by Medicare. The treatment of flat foot, routine foot care, and supportive devices for feet are foot care services that are not covered under Part A and Part B. Reminder, while most payers follow Medicare guidelines, not all of them do. So make sure you double check the guidelines of your respective private payers. Mayo Clinic's website defines flat foot as a common condition in which the arch on the inside of the foot flattens when pressure is put on it. People with flat feet have their feet pointing outward, and the entire soles of the feet fall and touch the floor when they stand up. So, services or devices, including prescription of supportive devices that are directed toward the care or correction of flat feet, are not covered by Medicare. As we mentioned in our first video lecture, unless your patient has a systemic condition, treatment for mycotic nails is routine, so an APN is required if criteria are not met. The list you see here are services that are considered routine and therefore not covered by Medicare. Note that orthopedic shoes and other supportive devices for the feet are generally not covered. Emphasis on the word generally. There are some exceptions to this rule, however. First, Medicare covers a supportive device if it is an integral part of a leg brace, and its expense is included as part of the cost of the brace. And second, Medicare covers therapeutic shoes if these were furnished to diabetic patients. Let's talk about the routine foot care indication and exclusion. In certain circumstances, services provided to Medicare patients may be covered if these are deemed necessary and integral part of otherwise covered services. I am talking about the diagnosis and treatment of ulcers, wounds, or infections, for example. The treatment of warts, including planar warts on the foot, is covered to the same extent as services provided for the treatment of warts located elsewhere on the body. For a routine foot care service to be covered by Medicare, there must be a presence of a systemic condition that either requires or does not require the active care of a PCP. More on this on our next video lecture. If, however, the patient does not have a coexisting systemic condition, a routine foot care may still be covered by Medicare if the physician was treating the patient's mycotic toenails, provided that the documentation supports the presence of mycotic condition or that there must be evidence of mycosis of the toenail. Also, the patient has marked limitation of ambulation, pain, or secondary infection resulting from the thickening and dystrophy of the infected toenail plate. wraps our Part 2 lecture video. I hope you learned a lot. I really enjoyed giving you this lecture today. Up next is Part 3 lecture video on billing and coding for routine foot care services on Medicare patients.